It'll say
It tells you, doesn't it?
There we go.
Okay, so morning everybody. My name's Jill and this is my colleague Sophie, and this morning we are joined by the lovely Wendy Adams from Skills for Care and the lovely Laura Watkins from Health Education England. And we're going to explore health and social care and careers within the NHS this morning. And we're going to chat with Wendy and Laura about the many opportunities that are available for people. Wendy, can you just give us a quick introduction of you and your role, please?
Yes, I'm Wendy Adams. I'm Locality Manager for Skills for Care. Skills for Care, we are an organisation who are funded largely by the Department for Health and Social Care to support the adult social care workforce with their various requirements around recruitment, retention, and the need for ongoing learning and development.
That's great, thank you. Laura, would you like to introduce yourself and your role as well, please?
Yes, certainly. So my name's Laura Watkins and I work for Health Education England. Health Education England is part of the NHS and we are mostly concerned with ensuring that the staff who work for the NHS exist in the right numbers and have the right skills. So that means that in my team, we have a look at the future workforce and people who are currently at school and college and perhaps thinking about their careers in the future.
Perfect, that's great, thank you. Okay, so we've got a few questions for each of you, so we're just going to kind of run through those, but if you've got any additional comments as we're going through, if you just want to kind of maybe build them in as we're going through the answers, otherwise we can come back to them at the end, okay? So Wendy, really interested in the work that you're doing, and there's lots of kind of myths and speculations around health and social care. So the first question for you is, if I wanted to work in health and social care, if I wanted to be a care or support worker, what sort of places might I work?
I think one of the fantastic things about health and social care and working in social care is the huge variety of places that you could potentially work. And a day in that life would look very different. So some people, for example, will work in a care home, and that might be a care home with or without nursing care. So you'd be working in that care home and providing care and support probably to older people. It might be older people with dementia, but there are also some care homes who provide support to younger adults with physical disabilities or people with a learning disability. But not all care is provided in a particular building. You know, some people will work in domiciliary care, and domiciliary care is sometimes called home care, and that would be where the care worker is out and about in the community, visiting people at home in their own houses and providing that care and support there. People might work in day services, which again might be providing support for older people, people with a learning disability, younger adults with physical disabilities. But people might also work in what we call supported living services. Supported living services are often for people with learning disabilities, where you might have 2, 3 or 4 people living in an ordinary house in an ordinary street, but who need some additional care and support. More recently, we've had the development of what's called the personal assistant role. So people might also work as a personal assistant, and what that means is you are actually directly employed by the person who needs the care and support. So rather than work with a range of people, you would work to provide care and support to that particular individual. So there's a huge range of different roles that people can work in across social care.
Do you know what, Wendy, that's really interesting, because I think there is a big myth around health and social care that it would be in a care home working with old people. So that's really cleared it up. Thank you for that. There's lots of opportunities for people to get involved, isn't there? And it's not the that kind of misconception that, you know, if you work in care, you look after old people. It's, you know, there's lots of other rewarding roles out there for people to get involved in. So thanks for that.
So Laura, a similar kind of question for you. So with there being similar opportunities in the NHS, would I have to go to university to work for the NHS?
Absolutely not. Some careers, yes, you do. So if you wanted to become a doctor, for example, or one of our scientists, that would be a route that you would much more likely go to a university, study a very specific degree. But there are so many roles working for the NHS. So yes, there are those that work in those sort of health and social care typical positions, offering hands-on patient care. But we have a huge range of staff who work in other roles, keeping the whole system running, where you do not have to go to university to do so. And even in the health role, more and more apprenticeship pathways are being developed all the time. So we are now developing what we call degree level apprenticeships. So you would enter the NHS perhaps through an entry level role or a sort of level 2 or level 3 apprenticeship. And over time, once you've become, for example, a healthcare assistant, you might then look at undertaking a degree level apprenticeship, which means you can work and study. So you'd be earning at the same time as achieving the same level qualification. So you could become a nurse, you could become a physiotherapist while you're working without having to attend university in that typical 3-year undergraduate way. It's a great way to manage the money side of it. And even better if university does seem like the route that you want to go down, for courses like nursing and some of our other allied health professions. So that is things like if you wanted to be a dietitian or a podiatrist, the NHS Learner Support Fund has been reopened as of last year, so you can get at least £5,000 towards your training if you did want to go to university.
That's brilliant, thank you.
Yeah, that's really great. So because of the pandemic, well, not just because of the pandemic, but I think it's been heightened. There's an increase in mental health struggles, you know, from all people of all ages, you know, in a wide range of settings. If somebody was interested in working in mental health, Laura, what kind of mental health careers are there available for people to pursue?
Absolutely loads. I think it's definitely worth remembering that we often focus on our physical health, especially in something like the NHS, but really every single role would play a part in supporting someone's mental health, even if it wasn't specifically in the job description. Even something like a paramedic, which we think of very specifically being hands-on, someone who is calm and patient and focused and can communicate clearly is going to support someone's mental health. But we do have some very specific career pathways if that's something that you're really interested in and want to make the focus of your role. Sadly, some of the names of these jobs are very similar, so can cause some confusion, like psychologist, psychiatrist, psychotherapist. And the difference between them, and those ones specifically, is that a psychiatrist, for example, is a doctor, so that is someone who has studied 5 years at medical school and then gone on to specialise in mental health as a doctor, whereas someone like a psychotherapist is more around actual talking therapies and supporting someone through very specific issue or problem with using those communication skills. We class roles that work specifically in mental health as our psychological professions. So that has a very specific area on the Health Careers website. So if that's something you want to look at, I'd head there for more information. Find out things like what skills you'd need, entry requirements for courses at university, etc. But there are other routes in too where you might necessarily not go to university, like being a wellbeing practitioner who might focus specifically on working with children at school. Or you might choose a route into something like occupational therapy or music or drama therapy. If you've got a skill outside of your desire to support someone's physical and mental health, if you're absolutely passionate about art or music or drama, you can actually use those skills to help people's mental health in a role in the NHS too.
So there's loads of different opportunities there then.
Absolutely, and you can work in hospitals or out in the community, much like what Wendy was saying. There's such a range of places and settings that you can work. Not all of our jobs are based in hospitals.
Thanks for that, Laura. So, Wendy, bearing in mind there seems to be quite a range of roles and things that you can get involved with. Is there such thing as a typical day as a care and support worker? And if there is, what would that look like?
I think it is really difficult to describe a typical day as a care and support worker, because it very much would depend on what setting you are working in. But I think what's really important is to recognise that there will be some roles where you do a considerable amount of personal care. So, for example, in domiciliary care, you might well do a lot of personal care around supporting people to get up, get dressed, get washed, have a shave, clean their teeth, use the toilet. But there will be other roles in which you might do much less personal care. So, for example, some of our learning disability support workers, a large part of their day is about going out in the community and actually supporting people to do the same sort of ordinary things that the rest of us do when we're not in a pandemic, like go bowling, go to the cinema, go to see the football, go to the supermarket, all of those day-to-day things. And I think that's really important to recognise that actually we as individuals spend a relatively small amount of our time in the day dealing with our personal care needs. Actually, a lot of our life is spent doing the other things that bring value to our life, like meeting family, meeting friends. And the issue about a care and support worker is often part of their role is about helping people to live that best life. So a typical day very much depends on what sort of service you're working in, who you're supporting, but it could involve anything from supporting somebody to have a shower to, going to the football match, or some personal assistants even go on holiday with the people that they support.
So there's, again, all sorts that's involved in those roles. And I guess if you're helping people to live their best life, which I love the sound of that sounds great, would you need maths and English to be a care support worker to do those things?
Maths and English is always something that is really important to have. If we think about how social care has changed, a lot of the care workers now are responsible for things like giving medication. They may be needing to take temperatures of people or of bath water. People might be taking pulse readings. So I think more and more there have been situations emerging in health and social care where people do need to have a good level of maths skills. But again, thinking about why it's important for people to have good English. Take for domiciliary care, for example. One care worker may go in at tea time and provide care and support to that person. They then leave, and a different care worker may come in at 10 o'clock at night to provide the next care visit. It's really important that those care workers have been able to competently document what they've done so that the next person who comes in is really clear about what care and support have been provided to people. So yes, I think increasingly the use of maths and English is important in social care, and we would really encourage that if you're thinking about going into a career in social care, that you do ensure that you've got those required skills.
Yeah, that's great. Maths and English are a really important foundation for lots of different careers, and I think it's important that people understand how they fit in with their chosen occupation. Laura, can you just expand on that a little bit further from roles within the NHS and how maths and English skills would be used, you know, just in a couple of examples within the roles that you have available?
Yes, of course, as I mentioned earlier, the NHS has so many different roles. You might have heard there's over 350 different careers. So you might have a role where someone is perhaps working to keep our buildings well maintained. So if you were perhaps a plumber or someone who worked on our estates team, again, obviously a very different setting, but similarly to what Wendy said, being able to communicate what is wrong, what the issue is, in order to get the problem solved very quickly. If you can imagine, if a ward didn't have heating or water or equipment that it needed very quickly, even if a role where you're not delivering hands-on patient care, that is crucial, not only in those communication skills, but making sure that perhaps the amounts or sort of quantities that are being used outside of healthcare roles are still important. In the healthcare setting, those written English skills can be really important in terms of note-taking. People who will have accessed GP surgeries or going to the optician or going to the chemist, you'll know that NHS staff do take notes when they talk to patients. So it's not just going to be them that read those notes again in the future. Really important to get the amounts, or whether it's about medication or the time that someone has perhaps suffered some symptoms, to get all that correct so that the treatment that they then are provided with is the correct one for them. In turn, all of this does not only better patient care, but it helps save money and it helps save time, and it makes sure that staff can actually focus on the job at hand rather than trying to decipher information that maybe hasn't been recorded clearly.
I do take my hat off to anybody that can decipher doctors' writing.
Definitely. So Laura, you mentioned that there's like 350 different roles. So if we obviously can't talk about them all today, but if we were to look at say if you wanted to become a doctor, so could you just talk us through what kind of qualifications you need? How long does it take to train?
Absolutely, I'll try and be as brief as possible. I think sometimes there's a misconception around doctors that everyone in the NHS is either a doctor or a nurse, and as I said, there's so many other careers. The doctor is part of what we call a multidisciplinary team, or an MDT, which means that they are not the lead singer in the band, they are not the starring role, they are incredibly important, but so are all of the other staff around them. So anyone who's wanting to become a doctor, we absolutely need you, we think that's fantastic, but part of the attitude that is as important as your qualifications is understanding that you are part of this amazing intricate system of other staff who all play a part in patient care. So working together with others, being compassionate is as important as your amazingly specialised skill as a doctor. Doctors do work in, I think there's around 60 different specialties, even in medicine. So that could be working specifically with children or with a particular part of the body, or even becoming a surgeon about something very specific on a particular organ of the body or a particular process. Initially, you would need to go to university for 5 years. So that's how medicine does differ from most degrees that would get you into healthcare jobs. Medicine is 5 years, and then you do a 2-year foundation programme. So you are earning a salary at that point once you've graduated and you're on that 2-year foundation programme, and you continue to work and train for up to another 8 years. So it does sound like a really long process, but in fact most not necessarily most, but a lot of doctors that you come across are what we would refer to as still in training, because it's you are always learning as a doctor. You don't just do your 5-year degree and go, right, well, I know everything now about the heart or whatever. Science changes every day, more and more research is done every day. So if you're going to become a doctor, you have to be open to continually developing and continuing your learning over time. But the one thing that again differs with medicine is that the UCAS deadline is different. So if that's something someone wants to pursue, be aware that that's usually mid-October when you need to get your UCAS application in for medicine, but also that you need to do an admissions test to get into medicine too, and that you need to apply for usually in the summer months. The Medical Skills Council, worth having, like, searching online for that for more information specifically about getting into medicine.
Thanks for that, Laura. So I guess that can be quite relatable in some ways, in that in a lot of careers you do have to continuously learn, but in some you have to maybe actually get a certificate at certain points to say that you've reached those specific milestones. So Wendy, if we could just flip it back to you around qualifications, what kind of qualifications? We spoke about maths and English being really important, but what are there any other qualifications you need to be a care or support worker?
In terms of being a care or support worker, I think without a doubt the most important thing that we're looking for in social care is about, as Laura said, people having the right values. We want people who are seeing this not just as a job that you get paid for, but that have a real commitment to providing person-centred care and recognising that actually sometimes it's the small things that make a difference to people's lives. And it might not seem like a big thing to you, but doing those small things that people like something done in a particular way can make a real difference to somebody's life. And that really, for care and support work, is what we're looking for more than any form of qualification. Having said all of that, many of the care and support workers that we have will go on to do level 2 or level 3 qualifications in health and social care. So it's not necessarily a role that you take on and don't do any qualifications. The opportunity to progress is still there. And I think there are some fantastic career opportunities within social care. Most of the managers of care services have actually started work as a care worker and have worked their way up through that through that organisation, or moved between organisations from being a care and support worker, maybe to being a senior or a team leader, a deputy manager, and then on to being the registered manager of a service. So I think there are career opportunities there. But I think the other issue in terms of qualifications is that actually if you want to go to university, there are also social care options there available. You know, you can do your A-levels, you can do qualifications like the extended diploma in health and social care, and then apply to university to do a social work degree. And again, I think there's lots of misunderstandings around social work. You know, people generally think social workers is all about working with children and families. But actually, you could be a social worker working with adults, working with older people, working in mental health services, working with people with a learning disability. So, you know, it's just as important to recognise that there are also degree level roles within social care, just as much as there are degree level roles within health. So that equally can be a great career path for people.
Absolutely, that's really important to hear. I think that there's a variety of options there as well once you really get into it.
Absolutely. Laura, so we talked about mental health opportunities and the increase in mental health struggles that people are facing at the moment, which might kind of inspire people to move into that area as a career. And similarly, as you mentioned before, it's as important that we look after our physical health as well as our mental health. you know, and we've got a lot of influencers now, or people doing physical activities online that people can get involved with, and there's pretty much something on every channel on YouTube that you can get involved with, or Facebook or Zoom sessions. So if that's my area and I'm really interested, and I feel like sports and social, sports science is an opportunity for me, and I'm looking at a degree course in that field, how would that fit in with the roles that you have within the NHS?
I think it's a growing field, and like I mentioned earlier, with doing things like art therapy or drama therapy, it's really lovely when you can take one of your personal interests into your day job. It really helps you love what you do. There are roles that you can do via the degree route that are very sort of specific professions, like becoming a physiotherapist, or you might even go into an area of work where you're looking at like heart health, or one of the like sleep clinics, to ensure that people are sort of particular areas of their lifestyle are going well to kind of improve their health. But you might not necessarily want to take one of those specific pathways. You might not want to use your passion to go and study medicine or go and study nursing, but you can take those skills into entry-level jobs. In fact, many moons ago, when I first started out working in the NHS, I worked in public health promotion. So I used to go to community centres and talk to people about healthy eating and lifestyle changes, and obviously that progressed over the years. And I think that's a lovely starting point, and there are roles in public health promotion. Public health is an enormous sector of the NHS. We need to not just focus on people who are already poorly, or maybe have a chronic condition that's where they need support, but in fact keeping people well. So all of those passions can be used in some of those pathways. Or you might choose to start out as something like a physiotherapy assistant, or an assistant in dietetics, so where you can use those skills and passions now, but in those roles you might find another passion that you can progress onto. So I think having a look on the Health Careers website on the Find Your Career tool is a great starting point. I'll make sure the link to that gets sent out. That's a series of questions where you can answer things like what you like studying, or what your personal interests are, and it'll generate a few ideas of jobs that specifically meet your passions or your interests.
That's brilliant. I think it's always really interesting to see where. So you said, if you do something that's your passion, it's really rewarding, and there is that saying that if you do what you love, you never work a day in your life. And I think it's really, really interesting for young people to understand how, where they can take their passion for fitness and sport and take it into a really rewarding career, and support people, like you say, not people that are necessarily poorly, but to support people and do that prevention piece as well, and using something that you passion and something that you love. I can't think of anything more rewarding. I think that's a brilliant opportunity for people. Thanks for that. So another question for you, Laura. We're looking at kind of, at the moment, where the way that we're working, it's quite difficult for people to get work experience. And we hear that hospitals can't take people on a face-to-face placement. And I think similar, obviously, for your sector, Wendy, as well, it's very difficult to take people on a face-to-face placement at the moment. Can you kind of widen that a little bit further and give us a bit of an insight of what the plans might be to help people get the experience they need?
Definitely, I'd say from an NHS point of view, even before the pandemic, work experience can be quite tricky. Hospitals need to make sure that not only are young people safe in the environments that they might be going into, but also that patient information is kept secure and confidential, and that you wouldn't necessarily be seeing something that could be harmful to either yourself as someone coming on a work experience placement, but also to someone who might be having surgery or giving birth or talking about something that's very personal or traumatic to them. So all of that has to be considered. Then we bring in a pandemic and lockdown on top of all of that, and of course, unfortunately, people can't even visit their own families often at the moment, and are struggling to even attend face-to-face doctor's appointments. So I'm sure you can understand that work experience placements are on hold, but don't despair. So 2 really clear things to try and remember in this. 1, colleges, universities, hospitals and community services that you might be applying to, they're aware of this too. They know that people who are currently in the years where they typically would be going out and getting face-to-face work experience, they know that that hasn't been possible. So they aren't going to hold that against you and write off your application because you haven't had that. First key thing to remember. The second is, you could have had all of the work experience placements in the world, but if you don't know how to reflect on them and talk about them in the right way in an application, then you would still not necessarily be successful. So, touching on something Wendy's already mentioned and something that I've sort of alluded to, is to try and find out a little bit more about the values of that we expect people to have in health and social care. The NHS themselves have 6 specific values that make up part of our whole NHS constitution. There's a little tool on the Health Careers website where you can sort of find out if you sort of measure up to those values, and I think there's a similar activity on social care too. Because if you can demonstrate how you are compassionate, how you look out for other people, how you treat other people with respect and dignity in your day-to-day life, then that's going to make you a lot more successful. And that might have been something like rescuing a cat, that might be supporting a friend through a breakup, it might be checking in with your nan on FaceTime once a week. You are demonstrating that you care about other people. And if you can, that sort of information to be included in a supporting statement, reflecting on why you think that that's important to other people, how that has bettered their well-being, that's going to be much more important than just saying, well, I went on a visit to a hospital and I can't really tell you anything about it. So I think have a look at what the values specifically are and how you embody them.
Perfect. Yeah, that's a great answer. That I think people need to do that little bit of research as well and understand what it is they want to get from that type of experience. That's great. Thank you.
So, Wendy, it's obviously Apprenticeship Week, and we've just been chatting about them there. So, a really good way of getting experience and getting some sort of pay is the fantastic thing about apprenticeships, right? So, can I do an apprenticeship in healthcare, social work, if that's the route I wanted to go down?
There are a range of apprenticeships now, as Laura already mentioned. So yes, you can do an apprenticeship at all sorts of different levels. So you can do an apprenticeship at level 2, at level 3, but in the same way that there have been higher level apprenticeships developed within health, there are also now apprenticeships for things like degree apprenticeships for things like social work as well. But yes, there are lots of apprenticeship opportunities available for younger people, and we've got a real desire to get more younger people to come and work in the social care sector. One of the real worries about the social care workforce is that we currently have a large number of the workforce who are over 50. And obviously on that basis, we know that social care is a growing sector. So we really need to get the message out there that we need more younger people to come and work in social care. And apprenticeships are a great way to do that. I think there are still a lot of myths about social care that, well, it's a job for older people, or it's a job for women but not for men. And actually none of that is true. You know, we need younger people. We have younger people who need care and support, and those younger people would probably prefer to be supported by another younger person. You know, for example, if we have somebody who is in their late teens, early 20s with a learning disability or a physical disability, and they need support, and that support is to do things like go out and about to the pub, go to the football, they don't want to be supported by somebody like me. You know, that young man doesn't want to be supported by somebody who would be perceived as being like his mother. You know, probably what he wants is to be supported by somebody who's young, who's a similar age, who might have similar interests. And I think apprenticeships are a great way of encouraging more younger people to come into the social care sector.
Absolutely, and it's a great way, like you say, to get experience and learn the trade whilst also getting paid. I think the key message there is that, you know, younger people do have a place within the health and social care setting, and you know, a lot of people want the younger people to work alongside them, like you say. Nothing against you, Wendy, and I'm sure anybody would love you to take them to a football match or to the Metro Centre shopping, but sometimes to have somebody you can relate to in terms of age and experience is really more powerful and effective way of working. So that's really great. I really like the sound of a career in health and social care, Wendy, but I'm not sure that I could do the same job forever. What would be my progression opportunities?
As I said, there's a whole host of progression opportunities available within social care. And one of the things that social care are very good at doing is promoting people from within organisations or within the sector. So lots of people will start as a care assistant and then move into other roles. So they might be promoted to being a senior care worker, to a deputy manager, to be a registered manager of a service. People sometimes move sideways into other similar roles. So you might work as a care and support worker, but then decide that actually you want to become a personal assistant for somebody, or you want to become an activities organiser. And as I said, there are people who are working in those frontline facing roles and then decide at a later date, well, actually, I want to go off to university and become a social worker, for example. But I think one of the other things that we're also hoping to encourage is that there's more career opportunities available by people moving between health and social care. And I think, you know, both myself and Laura are very keen that those options are available for people. So people can start in social care, but then are able to carry that learning and that experience across if they want to move into a health role, or vice versa. You know, there are some nurses, for example, who are employed not for the NHS, but who are employed in social care, actually in some of our care homes. And for some nurses, for example, that can be a really, really valuable role to undertake. But I think, again, that's not well known. Most people who go off to become a nurse envisage that they'll work for the NHS, and they don't realise that actually there are a huge number of nurses employed in social care settings as well. So I think in terms of career opportunities, we are moving much more to getting that ability to move not just around jobs within social care, but to move backwards and forwards between social care and the NHS services as well.
Yeah, absolutely. And I guess if you learn your trade in one area, it becomes transferable as well, doesn't it? So it just broadens your opportunities much further. Really interesting.
I've got sort of one of my last questions for you, Laura. So we've talked a lot about looking after patients in various roles in the NHS and care work, but say I'm really into IT, programming, maybe I want to go down more of a tech route. Are there job opportunities?
Absolutely. We have something that's called the NHS long-term plan, which sounds very dry and boring, but it's it's really important because it means it was set out what is envisaged for the NHS. Yes, we provide healthcare. Yes, we're concerned with people's well-being, but how are we going to achieve that when there's like a digital transformation happening in our personal lives, in our social lives? Everything that we do, even pre-COVID, was online. How is the health service going to keep up? So loads of jobs exist in those areas, making sure that patient information is all digitalised, it's shared correctly and securely. That's incredibly important. So there are loads of jobs, whether that is coming on through an apprenticeship in IT, or even if you wanted to study specifically, go to university or study to become like a developer or something, you might find later in life or in the next 5 years that the NHS as an employer has jobs that would suit you. We are an enormous part of like infrastructure in this country. A few years ago, there was an attempted hack on the NHS systems, which would have been absolutely devastating. Can you imagine if suddenly patient information either was inaccessible or was accessible to people that it shouldn't be? So we find more and more jobs are appearing every day in those behind the scenes jobs for cybersecurity and managing the information that we generate every single day in our communication systems. So if that's something that you think you might be interested in, but think, well, why would I work for the NHS as an employer? Have a look at either NHS Digital, so search for NHS Digital online. They've got some fantastic information about what they do and the careers available. Or if you think that the kind of management of health information and how that's sort of analysed might suit you, you could have a look at health informatics and on the NHS careers website.
Thanks so much for that. I think it's really important to know that if you're really interested in tech, you don't have to become work for a gaming company or something. You could work within the NHS. That's really interesting.
A couple of things that we've even commissioned lately are things like apps or online platforms, so that people can access things, either adults who are managing their own health or even for young people. We have a system at the moment for people who are in year 8 to learn more about NHS careers, believe it or not. And all of that has been developed by software gaming designers behind the scenes.
Brilliant. Thanks for that, Laura.
Yeah. So not only do you support people in a health and medical setting and provide that service, you're also very innovative in your approach and using things like apps. Obviously requires technical skills. So I think it is important that young people realise that, you know, you don't have to be a doctor or a nurse or a care worker or a physiotherapy to work in organisations as big as the NHS. There are all of the other roles. I think, was it 365 roles that you mentioned, or job opportunities? It's around that figure. I'll rewind back and hear the number, but there's hundreds of different career opportunities. So don't kind of be blinkered by, you know, it has to be medical because it's the NHS, or I suppose similarly for your sector, Wendy, there will be technical people within your sector as well, and people working behind the scenes to develop things and make sure that your systems are working smoothly and that everybody can get logged on to what they need to get logged on to. Both of you have mentioned websites that people can go to get additional information. So we'll share those links out with alongside this video. So we've got Health Careers website and the Skills for Care website, and there was a couple of other ones there that you mentioned, Laura, as well, the NHS Digital. So we'll get those links shared out along with other ones that we can share, so that people have got that kind of the go-to, so they can find out more information. So one last question for both of you, and we'll start with Wendy first. So what would be the one piece of advice you would give to somebody who was looking to work in a health and social care setting?
I think really concentrate on getting the English and maths, because that will be really useful to you whether you go into health or into social care. But I think also think about what relevant experience that you can get. And I think Laura talked earlier about, at the moment it is really difficult to get work experience or what would be seen as official work experience. But actually think really carefully about what you do in your own time and about how that could demonstrate that you've got the right values and skills. And that might be things like, when we're not in a pandemic, helping out at the local brownie group or scouts group. It might be about FaceTiming your grandma. It might be about all of those things that you don't recognise as necessarily being relevant, but that you're probably already doing. And I had a great example recently of someone who was interested in working with people with learning disability and autism. And this young man said to me, well, I've got no experience, so there'd be no point in applying to get a job. And I said, well, why are you so interested in this line of work? And he said, oh, well, my cousin's got autism and I go out with him every Saturday and have done since he was little. And I said, well, how can you say that you haven't got any relevant experience? There is nothing more relevant than that. So I think it is about, if you're a younger person, thinking about what can you do that would, as Laura said, give you something to talk about when you go for interviews. And that isn't always about paid work experience. It's about somewhere where you've demonstrated the values that we're looking for within social care. And that might be, in a whole host of situations that you're involved in.
Perfect. To think out the box a little bit and think about what you're doing already and how that can link in with your experience. Same question for you, Laura. So what advice would you give to somebody who's looking for a career within the NHS?
Very similar, and I suppose as an amalgamation of everything that I've said so far. A really good idea is to either get yourself a really nice little notebook or open up like a notes on your phone and just start to keep track of things. Something that I like to do is record myself talking or video myself, being like, why do I care about this? If I had to apply for my job today, again, I would have to write, a great long, maybe 500 words of why. Why do I want to do it? Why am I good at it? And it can be really hard having that like blank page feeling. The same as if you're trying to write homework on something that you just don't know where to start tackling it. And if you've got some motivators behind you, why do you care? Why did you care about this in the first place? It can be really important to revisit. So if you, at this stage in your time, are already collecting that information, imagine in 2 years' time, if you were trying to apply for a university degree, you can revisit that and go, oh yeah, I did really care. During the pandemic, these are the things I did. Because there's no way you would just remember those off the top of your head in a couple of years' time. I think, we're used to seeing things like people recording on their stories and things on social media, of like their journeys through time with something like, I don't know, if they were on a fitness boost or something. But why not think of your career like that? If this is something you're really interested in doing now, track it. It doesn't have to be for anyone else at all, but track it for yourself. Why do you want to do it now? So that in time, you can start looking back on how you've embodied those values. You might get some really good feedback on a piece of work at school or college. Might be nothing to do with health or social care. But if you can reflect on why that was, a quick 5-minute recording of yourself or taking some notes on your phone or notepad to say, I think I did well at this because I focused or because I asked for help, and remind yourself what your personal strengths are. It doesn't have to be something specific you've done that is getting you more experience in health particularly, but just using those skills around you and remembering why you're great, why you're interested in the first place, and collecting all the things that you're good at in one place, so that when you're faced with making an application, you don't suddenly feel like a fool trying to show off about yourself, because you're not showing off. That is who you are.
Brilliant bit of advice.
That's wonderful. Thanks so much, both of you, for joining us today and telling us about all the many different routes and opportunities into skills for care and through the NHS. It's been really interesting. I've definitely learned lots, and I'm sure it's been super useful for everyone at school or college who might be watching this. So thanks very much.
Thank you so much for having us.
Thank you very much.
Thank you. Take care, ladies. Have a good weekend.
Thank you.